Diabetes is the 7th leading cause of death in our country. It's estimated that 13% of Americans over the age of 18 have diabetes. 1 in 3 have prediabetes. The U.S. Preventive Services Task Force recommends earlier screening for prediabetes and type 2 diabetes for obese adults 35 and older. SpotRx's Chief Pharmacy Officer Neil Prezioso tells us about this new data and new information. Neil Prezioso is with us here today. Neil, thank you so much for being with us. Let's talk about diabetes. And the big news there, it seems, is that the age for screening has been lowered from 40 to 35. Can you tell us more about that?
Yeah, you bring up a really interesting point. In an effort to decrease the incidence of diabetes and associated health conditions, the United States Preventive Service Task Force just recently recommended a change. And that change is they recommend overweight and obese people aged 35 to 70 years old to be screened for prediabetes and type 2 diabetes. And that's a change. It used to be 40 years old and up, and they've recently changed that.
Why now? Why the change?
You know, one of the things is pre-screening or early screening is really important. When you think about 1 in 3 Americans have prediabetes, and most people with prediabetes are unaware of the risk. And so early screening identifies those risks so that preventable interventions can be initiated to prevent or delay type 2 diabetes from occurring.
Is this something someone should talk about with their doctor during an annual physical? How do you know you might have diabetes?
Yeah, I get that question a lot, and folks say, you know, what should I do? The simplest is schedule an appointment to see your doctor. So your doctor can do pre-screening for diabetes, you know, either a fasting blood sugar level test or an HbA1c test. And it's very simple, very fast. And so if you do one thing, schedule that appointment to get your blood glucose tested by your prescriber.
Now, if someone says, I feel perfectly healthy, I'm a little overweight, are there other signs that you might have diabetes or prediabetes if you're just overweight?
Yeah, I mean, they're the typical, and they're sort of non-specific, but I'm tired. I have a lot of I urinate a lot. I don't feel as good as I used to. I'm not as energetic. And so they're very much non-specific. But having said that, if you're tired and you know, you just don't have the energy that you used to have, and you're starting to put on weight, those are good signs, early signs to get in and get tested.
Is there a scale to if whether or not someone's obese or just overweight? Sometimes that formula changes. Is there a general idea here of what constitutes overweight or obese?
You know, I look at it as if you're overweight, if you are having trouble seeing your feet, you need to do something about that. And quite frankly, the 5 steps that I've always said, you know, what you can do about prediabetes or diabetes, you know, you've heard them before. It's eat less, move more, but the 5 are really dietary changes, physical activity, lifestyle changes. If you smoke, stop smoking. And if you happen to be on a medication that your prescriber has prescribed for you, example is metformin, take it as it's prescribed. You know, there's an old saying that says drugs don't work in patients that don't take them. And so it's really important, especially as a pharmacist, to make sure that you're adherent to the medications that you're on if your prescriber has put you on a medication.
And how would you define pre-diabetes as opposed to having diabetes?
You know, pre-diabetes is your blood sugar is below the levels that would constitute diabetes, or your A1C is below, but they're within a range that we need to be worried about you. And so those are predispositions to having diabetes. So it's really pre-diabetes is an early indicator that you're headed that way.
Okay, and I saw that 13% of Americans over the age of 18 have diabetes. Is that type 1 and 2? How does that break down?
Yeah, that's type 1 or type 2 diabetes.
What is the difference, just for people watching who may not really know the difference?
Probably the simplest way to put it is one, you can treat with an oral diabetic medication, and one, it's the traditional insulin. And typically one is early onset in life, and the other is later in life, and it's usually due to those things that I had mentioned, diet, lack of exercise, smoking, and other lifestyle decisions that folks make that drive that disease.
Okay, as we opened this whole segment, the reason why the testing is lowered to 35 is that there's a growing number of people that have been tested for diabetes, correct?
Correct.
Okay, so why is it higher today than it was a year, 2, or 10 ago?
You're saying why is
let me just clarify that.
Yeah.
So more people, it seems, are being diagnosed with diabetes today than they were maybe 5, 10 years ago. What do you think are the causes for that?
The traditional is sort of our diet. A lot more fast food, a lot more sedentary lifestyle. People are playing the games and sitting at home watching TV versus getting out and exercise. And primarily those are the two. And it gets back to sort of eat less and move more. Okay, and do you have any idea where the U.S. stands in terms of rating, how we rank with the disease of diabetes worldwide? Are we high up there in terms of other developed nations? Yeah, really high. And again, I think that goes back to the fast foods. A lot of other countries don't eat the fast food that Americans do. The other is a lot of other countries aren't as sedentary as Americans. So unfortunately, there's a lot of great things about our country, but one of the not so great is we have a higher incidence of diabetes than other countries that are fully developed.
Thank you, Neil, and you've given us a lot of great information to take away as well. Neil Prezioso, thank you so much for joining us.
Thank you all.